name is Lawson. This is MTVgh. NBTVgh, the best online TV channel in Ghana and beyond. For the purposes of this particular discussion or interview, let me take off my mask. Okay. So, like I said, my name is Lawson. This is NBTVgh, and we are here at the University of Ghana Medical Center, specifically at the Medical Training and Simulation Center, the Medical Training and Simulation Center. And this center has been in existence for close to 2 years, we are told. We want to find out what exactly they do, what is being done here at the center. So we are here to speak with authorities that are available, finding out their views on what this center has to offer our cherished viewer like you, the general public, how best we can all benefit from this particular center. So just join me on the ride whilst we go look for the director of the venue to speak with, and then we get to learn. Let's go.
NBTV, station, ajibe bia wa Ghana ha say. De hia say obe use data. No watch ni nyina, de ekoso wa fa na nyina, ye yi no NBTV. Nti misra mo a obia anwumre o, anopo awie o. Say ye di ho akwanuaba ni. Nti NBTV the best.
So Ghana, this is MBTV. Keep watching MBTV. It is the best among the best.
Training and Simulation Center of the University of Ghana Medical Center. We train health and non-health professionals using what we call mannequins. They are electronic gadgets that help us to create a realistic environment, which is risk-free. Realistic because it mimics what happens on the wards at the clinics, and then risk-free because you can practice several times on the mannequin without causing any harm or damage to it. So we have topics like suturing, for training of doctors and senior nurses. They come here. There's a model, a suture training pad that they use in learning how to tie knots during surgeries, how to suture very superficial wounds in the skin. We have basic life support training, which helps to provide help, immediate help to a victim who has suddenly collapsed from cardiac arrest before help comes by way of an ambulance system. So these are some of the things that we do. We create a theater environment, so doctors, nurses who work in theaters come here and we train them on the anesthesia machine. We train them on how to resuscitate a patient in theater we train them on how to do intubations and so on, And because these are electronic gadgets, they sort of mimic real life patients. And sometimes we use standardized patients. These are ordinary people who we train to mimic various disease conditions and use them to train others, health professionals. With non-health professionals, there are various topics that we can treat over here, like basic life support training, which is important for everybody, to learn how to do. And the key thing is doing it efficiently. You can do chest compressions. You can go and press on somebody's chest. If you don't do it properly, the end result will be disastrous. And there are emergency situations that you have to handle. We train people how to use the urethral catheter, how to examine the breasts and so on. We have lamps in some of these breast mannequins, so that they come and feel the lamp, so that when they see it in real life, they will be able to readily make a diagnosis. Simulation Center has been in existence for the past 2.5 years, and it's one of the best in Africa. In fact, it's only in South Africa that you have a similar structure. Yeah. And we rent the place out also for corporate organizations and individuals who want to train people.
So there you have it. This is one of the best facilities in Africa. Those were the exact words of Professor Aaron Lawson, the director for this particular facility, the Medical Training and Simulation Center. I think it's a beautiful edifice, and you should pass by one of these days to have a look. My next story will look at one of the learning areas or one of the training areas of the facility. That is the basic life support. Basic life support. What is basic life support? How can you and I benefit from basic life support training? My name is Blessing, and this is MBTVgh.